getting stronger is the key to success. Don't just stop at pain-free, get stronger. All right guys, so I just got out of physio and I'm gonna show you what's been going on when I was in there and just kind of what the physio guy and I went over, Michael, and then what I did after. This is the key. This is stuff that nobody ever does. This is the key to not only your rehab, but your strength training as well. So Michael here at Accelerate Physio, he's doing exactly what he's meant to do. Physiotherapist, he's restoring range of motion. He's breaking up sticky muscles and range of motion issues that I have in my shoulder and getting me out of pain, restoring my range of motion, like I said, and keeping things moving. But the pain-free is not the same as being strong, and getting strong is the key to my success in keeping my shoulder moving. So this video is going to recap the full spectrum of what we do here at DSR. In-house physio session with Michael at Accelerate Physiotherapy, and then the transition of what you do after physio's done. What you're gonna do in-house here at DSR or virtually on the app. All right, so this is just an overview of the full assessment I did with Michael. We did some external rotation, strength testing, and end range mobility, just kind of mapping out what's going on with my shoulders so we can properly do our session. So this is step one, getting the joint assessed and identifying what's restricted and why. He's just making sure what we're about to do is going to work and be effective.
There you'll have a little bit of scapula winging like deeper down, and then with that coming forward a bit, it'll just pull
shoulder rolls in.
Shoulder forward a little bit. What's going to happen is this is going to overcompensate as this is pulled forward.
Okay.
So what we can do is not only strengthen through here, but we can also work on soft tissue work through the trap area, through the back area, through the deltoid area. We can do some, we were talking about some needling, all that kind of stuff. And are you more left dominant or?
I'm left-handed, so.
Okay, so you're gonna use more of the
growing up, throwing left.
Right.
Working with my left hand, writing left.
Right on.
Hitting with like hockey with my left shoulder. I think that's just like.
Pulling all that
forward,
all in, right?
so
Yeah. I'll give Neil a couple things, like some specific exercises like serratus, anterior strengthening and scapula push-ups, stuff like that. But then Neil, from his end of things, he can take it along and like he was saying, the rear delts, working on stuff like this, like pull-ups, push-ups, working on the back more. Like I know that's... Okay, so my boy Mike and I are going through some dry needling. Personal favorite of mine.
So what this does is I'm essentially looking for trigger points in the muscle, and I stimulate those trigger points with the acupuncture of the dry needle, very similar to an acupuncture needle. And then from that helps release some of the muscle tension and some of the muscle knots in there. So think of a muscle knot as there's like a muscle fiber, and then there's a portion of it where there's not blood flowing through it properly. You stimulate it with the needle, and then it kind of releases that.
So I'm lying face down here. I'm in the prone position, and he's working on my left side. Start with my traps, then my mid delts and rear delts, and then finally into my neck. These are all the muscles that have been overworked and compensated because the shoulder isn't moving the way it should. They're tight, they're overloaded, and they need to be released before we can properly load and strengthen the area. So now I'm getting into the supine position, and he's going to be working the front delt and the chest. Same thing, tightness. It's pulling my shoulder down, that rotated shoulder. So the anterior chain is just as important as the posterior. The front is tight and the back is weak, the shoulder sits forward and nothing works properly. So just making sure my shoulder is in line, and when I do strength training and rehab, the right muscles are actually firing. So now here he's just moving my arm through some passive range of motion openers. I'm just kind of laying there like a dead fish. He's doing all the work, so I'm just chilling. This is deliberate, so after needling, the tissue is responsive and he's using the window to restore the range before it sets down. I'm just kind of getting the blood flowing as well.
Or yeah, you're gonna probably be sore up here, and like here, and then obviously the delta bit too.
Okay.
Anyways,
cool.
Yeah, so just go easy with the lifting for the next couple days, because if...
All right guys, so that was a classic physio session, something I do once a month just to clear up hip and shoulder issues. This video is obviously my shoulder. It's feeling sticky. It starts to get really sore. My range of motion dies down. But this is exactly what physio does. It restores range of motion, it gets the shoulder moving. But a lot of people don't strength train after, and that's the key to success. That's also the key to physio doing its job and working properly. People go to physio, they feel better, then they go back to training. And the few months later, they either get re-injured or the same issues come back and they end up going back into the chair. The shoulder doesn't break down because physio failed. It breaks down because nobody built the strength back. Nobody finishes the job. And that's where DSR comes in next. 5 exercises, all shoulder, all purposeful. Scapula push-ups teaches the shoulder blade to move before we load the joint. Okay, next we have swimmers, rebuilding the rotator cuff and the posterior chain. Then we have T-spine twist with the band, because if your mid-back doesn't move, your shoulders pay the price. So this opens up your T-spine really well and activates your shoulder as well. Next, we have W's, targeting the rear delts and lower traps. Always a weak spot for people, so these W's are money. And finally, we have turtle raises, pure low trap rear delt activation. This muscle controls everything overhead and keeps your shoulders rolled back. Okay, folks, so that's a good example of the full spectrum of continuing care. The full loop. You go to physio, you do your session. The key to success after is mobility and strength training. In this case, DSR Tier 1 mobility. This is what finishing the job actually looks like. Not just getting out of pain, but building the strength so you don't have to go back to where you were. If this video relates to you and this is where you are, post-physio, post-surgery, or just feeling aches and pains of life, you need to strength train. The moral of the story is getting stronger is the key to success. Don't just stop at pain-free, get stronger.